The United States, I would suggest, does not have a healthcare system. We have a series of systems, and those systems are spread out based on who your payment sponsor is, what kind of health plan you're in, where you live, what kind of delivery system you have. So if you're older, you have Medicare. If you have less means or you're unemployed at a point in time, you might have Medicaid. If you've got a job or you're in a company, you have commercial pay. These are all very different, and we do have uninsured people in the United States still today. So we have a series of systems. They operate differently. They have different access. They influence our lives in very different ways, and that's going to continue for some time to come. We don't foresee a future in which we'll have a single payer, single system, and everyone's in the exact same model. We're going to have a great diversity of models. We'll need to sort through how we can organize ourselves to deliver more effective care for people, and do that and worry less about our professional jurisdictions, who gets to do what happens between physicians and hospitals and nurses and pharmacists. We have a lot of intramural dispute and a lot of controversy around who should do and handle a certain procedure correctly. So we need to get organized. We need to sort a way to create something that's more people-centric, more accessible, less expensive, and require that we change our core jobs and change the way we do our work. That's something I think everyone intuitively probably grasps, but the actual implementation of that is pretty complex, so it's going to take some time to do that. Medicaid's so important to children's health because it's the single biggest program for kids in the United States. 30 million kids receive their health care from Medicaid. We've only got 75 or 80 million kids in the US, so it's a substantial percentage of the kids. When you throw in the Children's Health Insurance Program kids or the CHIP kids, we've got a number well north of 30 million people. So Medicaid is the number one payer for kids. In our children's hospitals, it's half of the revenue in many kids' hospitals. And we can't make significant progress on kids' health without a really effective Medicaid program that works on their behalf. I'm a huge optimist, and I feel that way only because although it is a complex topic, and healthcare has got many of these counterbalancing activities. When you talk to people in Washington and you talk to our legislators and policymakers, everybody loves their kids. It doesn't matter whether you're a fiscal conservative or a liberal. Everyone loves kids. They love their kids. I think we recognize generally the future of the country, and I'm quite confident that we will find a way through it all and make some headway on their behalf.